Attorney Jonathan Elson, reminding you that if you've been injured in an auto accident, it's important to have somebody on your side. When you need a lawyer,
you need Nelson.
We're doing recertification with our deputies, and one of the classes that we're doing is agitated chaotic events, formerly referred to as excited delirium. We've noticed an influx both locally and nationwide. It's becoming a problem where people are experiencing chaotic events during interactions with our deputies, and so we're taking the proactive step of making sure that our deputies are trained in how to handle that appropriately to try to mitigate any injuries or obviously the worst case scenario of an in-custody death. Signs of an agitated chaotic event. He is clearly sweaty. You can see the sweat on him abnormally. You can tell from his behavior. And remember, we're treating these as medical emergencies versus as a criminal activity at that point.
Are these caused by mental issues or drug-related issues or what?
So the answer is yes, all of the above. You are at much higher risk for an excited delirium or agitated chaotic event for drug use, mental illnesses. There's several physical ailments, heart-related, that also put you at risk for an agitated chaotic event. So as far as the research has shown, there's really not necessarily a specific trigger. They just have been able to say that people that are experiencing these events are traditionally under drugs, mental illness, those type of things. So most of our individuals that we encounter that have had these type of events do come back with some sort of a controlled substance in their system.
We've seen it in the past with diabetic patients, but just recently we've seen two that appear to be drug-related.
They do. Of course, those investigations are pending until all the results come back. But yes, both of those appeared to be drug-related. And we do, like you mentioned, diabetes is one of the predisposing factors for an agitated chaotic event. So we treat each of them, regardless of what is the trigger, the same. They're treated as a medical emergency. The criminal investigation takes a back seat while we make sure that the individual is safe and taken care of, and then we can follow through with our investigation subsequent to that.